Welcome to Worldwise Studio, where the world's biggest ideas become surprisingly simple.
Welcome to The Explainer. Today we're investigating a phenomenon that has completely changed the landscape of global public health. We are looking at exactly how a massive, highly engineered cloud of vapor has quietly enveloped one of the most vulnerable demographics on the planet. Why are millions falling victim to this fog? Well, let's dive right into it because the sheer scale of what we're dealing with here is truly unprecedented.
15 million. Take a second to let that number really sink in. According to the World Health Organization's latest global estimates, that is the number of youth, and we're talking specifically about children aged 13 to 15 who are using e-cigarettes right now. That's not just some marginal trend, right? That is a full-blown global epidemic happening in real time.
And that brings us to the core question we have to answer today. How exactly did we get here? I mean, think about it. The original pitch for the e-cigarette, the vape, was actually pretty noble. It was designed to help adult smokers quit combustible cigarettes. But somewhere along the line, that mission fundamentally shifted. It pivoted away from saving 45-year-old smokers and turned into a biological trap for teenagers.
It's a classic bait and switch. The original intent was harm reduction, right? Getting people off burning tobacco leaves. But what the data shows us today is the stark opposite. The industry is hooking millions of youths into a completely new wave of nicotine addiction. The target audience changed, and the product itself was weaponized to capture them. To really grasp the scale of this, let's look at the numbers. Globally, there are now 37 million youth tobacco users. In the US alone, FDA data shows about 2 million middle and high school students are currently using tobacco products. And to see how incredibly fast this moves across borders, just look at Nepal. In a single year, an astonishing 3.2 million vape devices were officially imported. To put that into perspective, that's into a country of just 30 million people. The fog is literally everywhere.
Section 1. Hijacking the teenage brain.
To understand why this fog is so incredibly sticky, we have to look under the hood at the adolescent mind. The human brain doesn't actually stop developing until around the age of 25. And because it's still very much under construction, the adolescent brain is uniquely vulnerable to nicotine. It acts as a disruptive force, actively interfering with attention, learning, and emotional development. The brain is quite literally rewiring itself around the drug. And because of all that rewiring, we're basically dropping a highly addictive chemical into an environment that is already craving dopamine. The sources point out that vaping doesn't just cause physical dependence, it actively exacerbates mental health struggles. Mood disorders, anxiety, suicidal ideation, and depressive symptoms are all associated with youth vaping. It completely undermines a teenager's ability to cope with everyday stress. But the damage hits hardest in one very specific place, the prefrontal cortex. This is the command center of the brain. It's responsible for critical thinking, moderating social behavior, and impulse control. Nicotine exposure actively impairs the development of this specific area, essentially shattering a teenager's decision-making abilities right when they are forming.
Let's geek out on the neuroscience of the trap itself for just a second. Nicotine artificially stimulates the ventral tegmental area and the nucleus accumbens. That's your brain's reward system. It floods these areas with dopamine, creating a massively powerful association between vaping and pleasure. And because the teenage brain is so adaptable, this trap springs incredibly fast, it grips way harder, and it's much harder to break than it is for adults.
Okay, so the science is absolutely clear here. This is a biological trap. Which naturally begs the question, who actually benefits from engineering this? If the product is rewiring kids' brains for long-term dependence, who is profiting from that lifelong subscription?
Section 2. Big Tobacco's Flavor Trap.
You know, the biggest players in vaping today are often the exact same tobacco giants who lost customers to public health campaigns over the last few decades. Now, they claim they aren't marketing to youth to secure new users, but, I mean, just look at the packaging. Look at the names. If these devices were truly meant for a 45-year-old trying to quit smoking, they wouldn't be packaged like colorful candy, and they definitely wouldn't taste like mango tango or bubble gum.
And if you need proof, just look at the data. Recent FDA numbers reveal a massive 89.4% of current youth e-cigarette users rely on flavored products. Fruit flavors lead the pack, followed really closely by candy and desserts. The numbers prove that sweet flavors aren't just some accident. They are absolutely the primary bait used to hook new users.
Now, check out this wild statistical detail. Over 53.4% of students vaping right now are using flavors with ice or iced in the name. This shows you exactly how highly engineered these chemical flavorings have become. The ice effect is deliberately designed to mask the harsh burning sensation of the nicotine. It makes it incredibly smooth and super easy for a young person to inhale deeply without coughing.
And all of this is fueled by a completely unseen, frankly predatory marketing machine. We're talking aggressive digital marketing on unregulated online platforms, targeting kids right on their phones. And out in the real world, age enforcement is practically non-existent in a lot of regions. As the sources note, in places like Nepal, a 14-year-old in a school uniform can buy a vape just as easily as buying a chocolate bar.
Section 3. The Global Regulatory Crackdown.
So, the good news? The world is finally waking up. We're seeing a shift from passive observation to aggressive legislative action. A huge part of this resistance is driven by the World Health Organization's Empower framework. Today, over 6.1 billion people, that is more than 75% of the world's population, are protected by at least one of these proven tobacco and nicotine control policies at the highest level.
You can literally see this momentum building right on the timeline. Thailand restricted them back in 2014. By 2019, India instituted a sweeping nationwide ban. Mexico escalated to a constitutional-level ban in 2022. And Kyrgyzstan, they're enacting full prohibition in 2025. All told, over 30 countries have now implemented full or near-full bans.
When you look across the international landscape, the trend is crystal clear. Regulations are tightening and fast. While places like the UK restrict youth access, countries like India and Mexico are making vaping completely illegal. France is actually taking steps to criminalize nicotine pouches altogether. Governments are moving way beyond just controlling access. They are shifting toward eliminating entire categories of these products to protect their youth.
Section 4. Clearing the smoke.
So what's the bottom line here? What should you take away from all this? First and foremost, we have to shatter the illusion. The industry sells the sleek, modern, clean aesthetic, but the toxic reality is deeply alarming. Vapor exposure is linked to long-term neurotoxicity, cardiovascular damage, and popcorn lung, which is permanent scarring of the airways. And environmentally, it's a total disaster. Millions of discarded lithium-ion batteries are creating a massive e-waste pollution crisis right under our noses.
I want to share a quote from Dr. Etienne Krug at the WHO that really hits the nail on the head. He says, "E-cigarettes are fueling a new wave of nicotine addiction, hooking kids on nicotine earlier and risk undermining decades of progress." This isn't just some bad habit kids are picking up. It is a fully recognized global crisis that threatens to completely reverse all the public health victories we've won against tobacco over the last 30 years.
So I'm going to leave you with this one thought. If you know for a fact that this device, its sweet flavors, and its slick marketing were intentionally engineered to turn a developing brain into a lifelong subscription service, will you let them profit off that dependence? The fog is incredibly intentional, but now that you see it clearly, you have the power to walk right out of it. Thanks for joining me on this explainer, and keep questioning the world around you.